Let's talk about middle ear analyzers and tympanometers now. These terms, middle ear analyzer and tympanometer, are interchanged by the manufacturers too. Some of them call everything a tympanometer, and some call their more clinically complete units middle ear analyzers, which is probably the correct way to go. And so the first decision is, well, do you want a middle ear analyzer or a tympanometer? Tympanometer, classically, it refers to more of a screener, where a middle ear analyzer is more diagnostic. And do you want one that is conventional or PC-based? The PC-based is rare. Most of them are actually hybrids, like this. This is a TympStar Pro. It replaced the old TympStars. I know you have a couple of those. You probably have this too, right? Yeah. So it's a hybrid in that it can operate standalone as well as have a connection to their software and therefore create an electronic record. And do I need any options? With many manufacturers, 1,000 hertz probe tone is an option. 1,000 hertz probe tone is something you would definitely want if you were doing pediatrics, especially newborns. You would use that especially on patients who, from birth to between 4 and 6 months old. If you didn't, if you just used the regular 226 hertz probe tone on them, then you would have some false negatives. In other words, normal tympanograms when they still have middle ear pathology. Right? So these are important questions. If I'm going to decide on a middle ear analyzer versus a screening tympanometer, I probably did that for several reasons. One, I want to have acoustic reflex, and I want to be able to control the acoustic reflex testing myself manually. I want to be able to choose frequency, choose intensity, apply the stimulus, see the result in the change of compliance, and determine myself what the threshold is. If I want that capability, it always puts you into the middle ear analyzer range. And I want to be able to do that ipsilaterally and contralaterally. And I want to do eustachian tube function for perforated eardrums and non-perforated eardrums. I want to be able to do reflex decay. All those things put you in the category of a middle ear analyzer. Because typically on a screening tympanometer, it's just a tympanogram, or it might have acoustic reflex on it, but it is simply automated. It's automated to do one or more frequencies and either say yes or no that there was a reflex at a particular intensity, typically 90 or 95 dB. Some of them will determine a pseudo threshold. But it is always a pseudo threshold because you didn't determine it, the machine did, and the machine did not do it like you do. It didn't go up in 5 dB increments until it found a threshold. It will probably just go 80, 90, 100, period, and then give you what they call a pseudo threshold. Let's see. So this TympStar Pro is our most popular one in the area of a middle ear analyzer, diagnostic middle ear analyzer. As far as tympanometers, what's out there? Grayson Stadler makes one. It's a GSI 39, has a printer built into it, a pencil-shaped probe, very common and very popular. You can get it IPSI only or IPSI and contra. 4 frequencies, pseudo thresholds. There are handhelds. This is a Grayson Stadler handheld. It's called a Legro. This is a Mako handheld. It's called an Easy Tymp. You can take it out and hand hold it and put it back in its cradle and it will print out from that printer. Here's another Mako. It's very nice. It's got a touch screen on it, pencil-like probe, printer built in the back. So if you're just doing TIMPs and reflexes, and if you had just either screening reflexes or pseudo-thresholds at 4 frequencies were good enough, you can get it where it does just IPSI only or IPSI and contra, then that might be a less expensive choice. So you would save money that way if you didn't require that more advanced testing. Included in that more advanced testing, as I had said earlier, would be eustachian tube function for perforated and non-perforated tympanic membranes, as well as reflex decay. So if there are things that you want to do, you would need that. You'd have to look at the particular model to see if 1,000 hertz probe tone is available on it or not. With some of these it is available, some it isn't. And if you're doing very young pediatrics, you certainly have to have that. It's a must. Here are some other middle ear analyzers, clinical middle ear analyzers. You saw the TIMPSTAR Pro. Interacoustics has one called the AT, like Anthony Thomas, 235. And that does everything. It can even be mounted flat, has a nice color display, as they all do. It can be mounted flat on the wall inside the booth even. It's very nice, and it has all the features. And it's a little less expensive than the Grayson Stadler. Instead of being like 9,500, it's more in the area of 7,200, a little less expensive. And there is a handheld that has gotten very popular that is called a Titan. You have a Titan here. You have an older one and a newer one. I'm sure the newer one works better than the older one. One thing I would say on these is if you can operate them in the cradle, that would be better. Sometimes if you have somebody that's taken it in and out of the cradle 1,000,000 times a day, you can actually wear out the connection. So I tell people, leave it in the cradle. A lot of times you can do that and have the patient sit there, and it'll be better. Anyway, this thing will do either, it can be bought in various different models, some that just do screening tympanometry, some that do like a middle ear analyzer, they do everything. You could have otoacoustic emissions on there, either DPOAE or TEOAE, screening or diagnostic or both, and even have infant screening ABR on there.